Bupropion, better known by the brand name Wellbutrin, is often praised for lifting mood, boosting focus, and helping with energy levels. But while it can be a game changer for depression or quitting smoking, it's not without its risks. Some side effects are mild and temporary, while others can be serious and even dangerous if ignored. In the next few minutes, we'll uncover 10 potential side effects of Wellbutrin, what they feel like, why they happen, and when to seek help. By knowing the signs early, you can work with your doctor to protect your health and still get the benefits you need. 1. Insomnia and sleep disturbances. One of the most common complaints among people taking Wellbutrin is trouble sleeping. This medication works by increasing the activity of certain brain chemicals like dopamine and norepinephrine, which can boost alertness and energy. While that's helpful during the day, it can be a problem at night if the stimulating effects don't wear off in time. People often report lying in bed wide awake, waking up multiple times during the night, or feeling restless even when they manage to sleep. For some, this sleep disruption shows up within the first few days of starting Wellbutrin, while for others it develops gradually. Lack of sleep not only leaves you feeling tired and irritable, but it can also reduce the medication's benefits over time, as good rest is essential for mental health recovery. Poor sleep can worsen mood swings, heighten anxiety, and even weaken the immune system. To reduce the risk of insomnia, many doctors recommend taking Wellbutrin earlier in the day, ideally in the morning. Splitting doses so that the last one is before early afternoon can also help. Establishing a calming bedtime routine, limiting caffeine in the afternoon, and avoiding screens for at least an hour before bed are all effective strategies. If sleep issues persist or worsen, talk to your healthcare provider. They might adjust your dosage, switch you to an extended-release version taken once daily in the morning, or consider a different antidepressant. Insomnia doesn't have to be an unavoidable trade-off when using Wellbutrin. With the right timing and habits, you can often protect your sleep while still benefiting from the medication. 2. Dry mouth. Dry mouth, also known as xerostomia, is another frequently reported side effect of Wellbutrin. It happens because the medication can reduce saliva production by affecting the nervous system's regulation of the salivary glands. While this might sound like a minor inconvenience, persistent dryness can have a significant impact on daily comfort and oral health. You might notice a constant sticky feeling in your mouth, difficulty swallowing certain foods, a change in taste, or even a sore throat. In some cases, cracked lips, mouth sores, and bad breath can develop as bacteria thrive in a low saliva environment. Saliva isn't just for comfort. It plays a key role in protecting teeth and gums. Without enough saliva, the risk of tooth decay, gum disease, and oral infections increases. This makes it important to address dry mouth early rather than simply tolerating it. To ease symptoms, stay hydrated throughout the day, sipping water regularly rather than waiting until you feel thirsty. Sugar-free gum or lozenges can help stimulate saliva flow, while alcohol-free mouthwashes can soothe the mouth without drying it further. Avoiding caffeine, alcohol, and tobacco can also prevent additional moisture loss. If dry mouth persists, let your healthcare provider know. They may recommend a saliva substitute, adjust your dosage, or check for other contributing factors such as dehydration or additional medications. In many cases, small lifestyle changes can keep this side effect manageable, allowing you to continue benefiting from Wellbutrin without compromising oral health or daily comfort. 3. Increased anxiety or restlessness. While Wellbutrin is often chosen for its energizing effects, in some people, that same stimulation can tip over into increased anxiety or restlessness. This happens because the medication boosts levels of norepinephrine and dopamine, brain chemicals that heighten alertness. For individuals already sensitive to stress or prone to anxiety, this heightened state can feel uncomfortable, manifesting as racing thoughts, irritability, jitteriness, or an inability to relax. Physically, you might notice a rapid heartbeat, tense muscles, or even a mild trembling in your hands. These symptoms often appear in the first few weeks of starting Wellbutrin or after a dosage increase. While they may lessen as your body adjusts, for some they can persist and interfere with daily life. Increased anxiety can disrupt sleep, reduce concentration, and in some cases, counteract the medication's intended benefits for depression. There are practical steps to manage this side effect. Taking the medication earlier in the day, practicing slow breathing or mindfulness exercises, and engaging in regular physical activity can all help release build-up tension. Reducing caffeine and other stimulants is also key, as these can amplify restlessness. If anxiety remains high or worsens, it's important to speak with your healthcare provider. They might adjust your dosage, space it differently, or pair Wellbutrin with another medication that has calming effects. By addressing this early, you can strike the right balance, enjoying the uplifting benefits of Wellbutrin without feeling constantly on edge. 4. Headaches. Headaches are a relatively common side effect for people taking Wellbutrin, especially during the first few weeks of treatment. They can range from a dull, lingering ache to sharper, more intense pain that disrupts concentration and daily activities. These headaches are thought to be linked to changes in brain chemistry, particularly shifts in dopamine and norepinephrine levels, as your body adjusts to the medication. Additionally, Wellbutrin can sometimes cause mild dehydration or interfere with sleep, both of which can contribute to head pain. For some individuals, these headaches are mild and fade on their own after the initial adjustment period. For others, they may persist or flare up intermittently, making it difficult to focus or maintain productivity. In some cases, headaches may be accompanied by sensitivity to light, nausea, or tension in the neck and shoulders. To help reduce the likelihood of headaches, make sure you're staying well hydrated, eating balanced meals, and getting adequate rest. Limiting caffeine can also help, as excessive intake may worsen head pain. Over-the-counter pain relievers can be used occasionally, but it's important to consult your doctor before taking them regularly to avoid unwanted drug interactions. If headaches are severe, persistent, or accompanied by other symptoms like vision changes or confusion, seek medical attention promptly. Your healthcare provider may adjust your dose, change the timing of your medication, or consider switching to another antidepressant if headaches remain a problem. The good news is that for many people, this side effect lessens over time as the body adapts to Wellbutrin, allowing them to continue treatment without constant discomfort. 5. Gastrointestinal issues, nausea, constipation. Wellbutrin can sometimes cause digestive discomfort, with nausea and constipation being among the most common gastrointestinal side effects. Nausea may appear shortly after taking your dose, especially in the first few weeks of treatment, and can range from a mild queasy feeling to more persistent stomach upset. This is thought to be related to how Wellbutrin influences the central nervous system, which also communicates closely with the digestive tract. Constipation, on the other hand, may develop more gradually. It occurs because changes in neurotransmitter activity can affect muscle contractions in the intestines, slowing the natural movement of waste through the digestive system. In addition, some people may drink less water or experience a decrease in appetite while on Wellbutrin, which can make constipation worse. To manage nausea, it can help to take your medication with food, avoid heavy or greasy meals right before dosing, and opt for small, frequent meals instead of large portions. Ginger tea, peppermint, or bland snacks like crackers may also help calm the stomach. For constipation, increasing your fiber intake through fruits, vegetables, and whole grains is key, as is staying well hydrated and maintaining regular physical activity to stimulate bowel movement. If these digestive issues persist or become severe, speak with your healthcare provider. They may adjust your dosage, suggest over-the-counter remedies, or evaluate whether another medication would be a better fit. While uncomfortable, nausea and constipation are often manageable with small lifestyle changes, allowing you to continue benefiting from Wellbutrin without significant disruption to your daily routine. 6. Elevated blood pressure. While Wellbutrin is not typically known for causing major cardiovascular issues, it can, in some cases, lead to elevated blood pressure. This side effect is linked to the medication's stimulant-like effects on the central nervous system, which can cause an increase in heart rate and vascular resistance. For most people, any rise in blood pressure is minimal, but for those with pre-existing hypertension or other heart-related concerns, this change can be more significant. Elevated blood pressure may not cause noticeable symptoms at first, which is why it's often called a silent condition. However, in some cases, people may experience headaches, dizziness, blurred vision, or a feeling of pressure in the chest. If left unchecked over time, high blood pressure can increase the risk of more serious complications like heart disease, stroke, or kidney problems. Doctors typically recommend checking blood pressure before starting Wellbutrin and monitoring it regularly during treatment, especially for individuals with a history of hypertension. If readings begin to creep upward, adjustments can be made. This might include lowering the dosage, adding a blood pressure-friendly lifestyle plan, or switching medications if necessary. You can also take steps on your own to help control blood pressure while on Wellbutrin. Reducing salt intake, maintaining a healthy weight, staying active, managing stress, and avoiding excessive alcohol can all make a meaningful difference. If you notice any new cardiovascular symptoms, it's important to let your healthcare provider know right away. By being proactive, you can reduce the risks associated with elevated blood pressure and still benefit from Wellbutrin's positive effects on mood and focus. 7. Weight changes. Wellbutrin is unique among antidepressants because it is less likely to cause weight gain compared to other medications in its class. In fact, for some people, it can lead to modest weight loss due to its stimulating effects, reduced appetite, or mild increase in metabolism. However, not everyone experiences this benefit, and in certain cases, Wellbutrin can cause weight gain instead. Weight loss with Wellbutrin is often linked to decreased cravings, especially for carbohydrates or sugary snacks, and a general reduction in appetite. While this might sound like a positive side effect, rapid or excessive weight loss can be problematic, leading to nutrient deficiencies, fatigue, or muscle loss if not monitored. On the flip side, weight gain may occur in individuals who experience increased appetite, fluid retention, or lifestyle changes while on the medication. For people already concerned about their weight, these changes can be frustrating or even emotionally triggering. That's why it's important to monitor your weight regularly and maintain healthy eating habits regardless of whether you notice a loss or gain. Balanced meals rich in lean protein, whole grains, vegetables, and healthy fats can help stabilize weight. Incorporating regular physical activity not only supports weight management, but also boosts mood and energy levels, complementing the effects of Wellbutrin. If weight changes become extreme or concerning, discuss them with your doctor. They can evaluate whether the medication is the main cause and decide if adjustments or additional interventions are necessary. With mindful monitoring and healthy lifestyle choices, most people can manage weight fluctuations while still benefiting from Wellbutrin's therapeutic effects. 8. Dizziness and lightheadedness. Some people taking Wellbutrin experience dizziness or lightheadedness, especially in the early stages of treatment or after a dosage change. This effect can occur because Wellbutrin influences neurotransmitters that not only affect mood, but also play a role in regulating blood pressure and balance. A sudden drop in blood pressure when standing up, known as orthostatic hypotension, may occasionally happen, making you feel unsteady or faint for a few moments. Dizziness can be mild and fleeting, but for some it becomes bothersome enough to interfere with daily activities like driving, climbing stairs, or operating machinery. It may also be accompanied by blurred vision, headaches, or a feeling of mental fog. Factors like dehydration, skipping meals, or consuming alcohol can make these sensations worse. To reduce dizziness, try standing up slowly from sitting or lying positions. Stay well hydrated and eat regular balanced meals to maintain stable blood sugar. Avoiding alcohol and limiting caffeine can also help stabilize your system. If you notice dizziness primarily after taking your dose, talk to your doctor. They may recommend adjusting the timing, splitting the dose, or reducing the overall amount. In rare cases, dizziness may indicate a more serious reaction, especially if it's accompanied by chest pain, irregular heartbeat, or confusion. If that happens, seek medical help immediately. For most people, though, this side effect improves as the body adjusts to Wellbutrin. And with a few lifestyle adjustments, it can be managed without disrupting treatment. 9. Allergic reactions, rash, itching, swelling. Although uncommon, allergic reactions to Wellbutrin can occur and should be taken seriously. These reactions may range from mild skin irritations to more severe symptoms that require immediate medical attention. Mild cases often present as itching, redness, or small patches of rash, usually appearing within days or weeks of starting the medication. While these may seem minor, they can sometimes worsen over time if left unaddressed. In more severe cases, allergic reactions can lead to swelling of the face, lips, tongue, or throat, a condition known as angioedema. This is particularly dangerous because it can restrict breathing and swallowing. Other signs of a serious allergic reaction include hives, severe dizziness, and difficulty breathing, which may indicate anaphylaxis, a medical emergency. If you notice a rash that spreads rapidly, swelling, or any breathing difficulty, seek immediate medical care. Even if symptoms seem mild, it's important to inform your healthcare provider promptly so they can determine whether you should stop the medication or try an alternative treatment. To reduce the risk of allergic reactions, always inform your doctor about any known allergies, especially to medications, and report any new symptoms early. Avoiding self-adjustments to your dose and carefully following your doctor's instructions can also lower the risk of adverse responses. While allergic reactions to Wellbutrin are rare, recognizing the warning signs early can make all the difference in preventing serious complications. 10. Seizures. Seizures are one of the most serious but rare side effects associated with Wellbutrin. This medication can lower the brain's seizure threshold, meaning it makes it slightly easier for abnormal electrical activity to trigger a seizure. While the overall risk is low, affecting roughly 1 in 1,000 people taking standard doses, the likelihood increases significantly at higher dosages or in people with certain medical conditions, such as a history of seizures, eating disorders like bulimia or anorexia, or heavy alcohol use. A seizure can manifest as sudden muscle stiffness, jerking movements, loss of consciousness, or confusion afterward. Sometimes there may be warning signs such as unusual sensations, dizziness, or visual disturbances, but in many cases, seizures occur without warning. Experiencing even a single seizure while taking Wellbutrin requires immediate medical evaluation, as continuing the medication could increase the risk of another event. To reduce the chance of seizures, doctors usually prescribe the lowest effective dose and increase it gradually if needed. It's also important to take doses exactly as directed and avoid doubling up if you miss one. Limiting alcohol intake, maintaining proper hydration, and avoiding abrupt withdrawal from other substances can also help lower risk. If you have any pre-existing risk factors, your doctor may monitor you more closely or recommend an alternative antidepressant. While the possibility of seizures is concerning, it's important to remember that this side effect is rare, and with the right precautions, Wellbutrin can be taken safely by most people. Staying informed and aware of warning signs is the best way to balance treatment benefits with safety. Wellbutrin can be an effective treatment for depression, anxiety, and even smoking cessation. But like any medication, it comes with potential risks. Today we covered 10 possible side effects, from common issues like insomnia and dry mouth to rare but serious complications such as allergic reactions and seizures. The key takeaway is to stay alert to changes in your body and communicate openly with your healthcare provider. Never stop or adjust your medication without medical guidance. If you found this information helpful, give this video a like, share it with someone who might benefit, and subscribe to MediMint for more clear, trustworthy health tips every week.